It's one of the worst nightmares of a parent, watching your child suffer and not know what to do about it. On this podcast of Looking at Lyme, we're going to examine how Lyme disease affects children. If nothing else, Lyme disease is indiscriminate. The most simple walk in the park, or game of hide-and-go-seek, can result in a tick bite. We're going to meet a pediatrician who had a front row seat to understanding how Lyme disease can impact your family. Hello, I'm Sarah Cormode, and I'm the host of the Can Lyme podcast, Looking at Lyme. Children are among the most vulnerable to ticks for many reasons. Healthy kids love playing outdoors, and they may not even know that they were bitten by a tick because they can't feel the bite. Children are especially vulnerable because they're low to the ground. They love to roll in the leaves, they love to play in the grass, they love to cuddle with their pets, and all of these activities make them more susceptible to a bite. Not only is Dr. Ted Cormode an expert in Lyme disease, he's also my dad. You could say the Cormode family has become well acquainted with this disease out of necessity. I've been healing from Lyme disease for 8 years now, and my dad has scoured through the medical research to help solve this problem. He's also consulted as a pediatrician on a number of cases. Hi, Dad. Thanks so much for being on the podcast today.
What podcast?
How do you tell the difference between signs and symptoms in children?
Well, Sarah, that's an interesting question because Lyme is symptom-rich and sign-poor. Symptoms are subjective things that you talk about, that you say, I have a sore joint, and a sign is something that you can see, take a picture of, take an x-ray of, show it to your friends. So a swollen joint would be a sign, and a sore joint would be a symptom.
What about a sore brain? What would that be?
Well, that would be a headache, and that would be a symptom.
How does Lyme disease present in children?
I would say that Lyme disease in children presents very similar to adults, except, of course, depending on the age of the child, it may just complain that the knee is hurt, and you see a swollen knee, and that happens a little more often in children perhaps than in adults, depending on the age. They'll often just say that their tummy hurts, or that they feel awful. I had one child that said it felt like he was vibrating inside. And if an adult said that, they'd say, oh, come on, this guy's cuckoo. So children may say things in their language that we don't quite appreciate what they're saying, but that's their way of saying, I really feel rotten.
It's almost a little bit like my pet Lucy, my dog Lucy, and I can't really, I have to observe her and pay attention to, her behavior to try to figure out what's going on with her because she can't talk to me.
Exactly. You see her limping and you think there's something wrong in her feet or her knees or her hips. Yeah.
Do you recall a case of a child that stands out in your mind?
Well, I had a 10-year-old girl who lives in the far north in Northwest Territories. She spent some time visiting relatives in the south part of Alberta. She camped with the family. They hiked in the bushes. And when she left, she had car sickness on the way home, something that never has happened before. When she got home, she had a fever. She had myalgia, muscle pain. She had arthralgia, joint pain. She had tummy ache. She had headache. And in all, she had, I think it was 7 symptoms and one sign. The one sign was fever. She went on to develop extreme fatigue. Somebody that was, she actually was off school and was homeschooled for a year and a half. Somebody who was visiting, a physician that was visiting the area, said, you might have Lyme disease. And they took a test that came back equivocal But in the meantime, she'd also had a sleep study. Somebody did a study to see if she was sleeping well. And of course, children as well as adults who have Lyme disease have terrible insomnia and don't sleep well. And the sleep study showed that she had obstructive sleep apnea. As a coroner and a reviewer of pediatric deaths, we became aware that adults that do adult tests on children can often misinterpret them, and certainly the people involved, the physicians involved, felt there was no evidence of obstructive sleep apnea. But they proceeded to take her tonsils out, after which time, and actually gave her an antibiotic for 10 days. And at the end of the 10 days, she was entirely well and went back to school. The antibiotic was stopped after 10 days, and very quickly she regressed.
So the antibiotic is what helped her get better.
Clinically, all those symptoms suggested that she had Lyme disease. And so she was started back on antibiotics. She took antibiotics for 3 months, at the end of which time she again, about 2 weeks later, she again had some symptoms, was given antibiotics again. And at the end of those antibiotics, she was well and continued to stay well and got back in with her friends, doing all the things she did before. And I should have mentioned that during the hiatus there, she had referrals to a lot of different specialists, a lot of different tests, EEGs, ECGs, brain scans, and none of them came up with the correct or real diagnosis. And the response to the antibiotic and the clinical history and the predominance of symptoms would suggest that that's what she had, but the test did not confirm that, and that is not a reason to say she did not have Lyme disease.
Yeah, that story is so familiar, but I think what's great about that story is that child had recovery and intervention.
Yes, complete recovery, and I have phoned her almost every year when something like this comes up. I phone and say, "How are you doing?" And she's now 16 and doing extremely well.
What would the impacts have been if that child had not been treated?
It could have been progression to other complications of Lyme, such as carditis, which has been reported a number of cases recently in the Canadian Medical Association Journal.
Right. There were recently a few case studies presented in the Canadian Medical Association Journal. And
yes, there were, and I think it was May 30th or about 2 issues ago, and there were 3 cases presented. They all had carditis, and that's why they were being published, and probably because it was Lyme Awareness Month. What I noticed, rather than the carditis, which was kind of exciting to see how they treated it, but all 3 people, when they first presented to another source, an emergency room, a doctor's office, all 3 of them had, from highly endemic areas, had rashes and were with some with arthralgia, fatigue, and clearly had more than just the flu, which one was diagnosed with. All three rashes were misdiagnosed, and so the opportunity to start them on early treatment was lost. They were treated for some for 1 month, some just a week delay. One was 2 to 3 weeks, and one was in fact 15 days, and there was 1 death. So these are all people that, had they been treated early, would quite possibly have avoided that.
How prevalent is Lyme disease in children?
Well, it depends on the area, of course, in which they live. The higher the incidence of ticks bearing infected that are infected with Borrelia, the higher the incidence of Lyme. There's no higher in children than it is in adults in the same situation.
Does it affect children more acutely, would you say?
I wouldn't say so. No. The girl I told you about she was a year and a half before she got started on treatment after her tonsils were removed.
So for children as well as adults, it's really important that they have a family physician so that they have an accurate history of that patient.
Right. So to me, the loss of the traditional family doctor is one of the biggest saddest events in medicine. There are more people going into specialties now, and the general practice is the most difficult profession of all, and they know the families well, and so they don't dismiss the fact that they present with 5 or 6 or 7 symptoms and say you can't possibly have so many things wrong, because he's been coming to them, or he or she's been coming to them for the last 5 years and hasn't been to the office once except maybe to get an immunization. And he knows the rest of the family that they don't show up a lot either. So he can eliminate that consideration, which is often what patients who have numerous symptoms and few signs are accused of.
So if parents are taking their children into the outdoors this summer, what are some of the things they should consider to help prevent tick bites?
Well, they certainly don't need to stay away from areas where there's that are highly endemic. And for instance, the Kingston, Cornwall, Ottawa triangle is a highly endemic area. Southern Alberta, or rather southern BC, on the island and along the west coast of BC have been identified as areas at risk. So I'd still go to those areas, but you should take protection. Tuck your pants in your socks and spray yourself, ideally with something containing DEET, but there are some naturopathic solutions that are felt to be adequate as well. And stay on trails and do tick checks when you get home. And another thing to keep in mind is if you find a tick on you, there may be 2 more as well. So don't stop with the one that you see. Be sure to check your gain. And a good thing, if you've been out in the woods and not hiking through especially long grass, when you get home, take the clothes off, put them in the dryer for 15 minutes, and the heat will kill any that are there. Washing them won't necessarily kill them.
And we all love our furry friends, but is it a good idea to have our pets sleeping on our beds with us?
No, I've told you that you shouldn't have your dog sleeping on your bed.
So as a parent, I mean, I'm your child, I'm a grown child, but how was it for you being the parent of a sick child?
Well, it was awful, and it was terrible. And I remember you calling me from your car to say that you had tingling in your face and numbness in your fingers and your toes and a terribly sore neck and pain in your ear and photophobia and hyperacusis and I knew nothing about Lyme disease at that point except the name. And so since then I've read widely. I'm aware that there's an increased suicide rate in people who've had persistent Lyme or post-Lyme complications, and so whenever we phoned you and you didn't answer the phone, we'd have somebody check on you and assure us. And you were fortunate to have some very, very good friends that were one who was shared the accommodation and they were very helpful for us and for you, and it is so nice to see you back very close to normal.
Indeed. Couldn't agree more. So what advice would you give to other parents having gone through that experience?
If the doctor says something outlandish like no one in Alberta has Lyme disease, there are no ticks here with Lyme disease, or I've never seen that before, or it couldn't possibly be that. He said anybody that's that dogmatic, you should get a different doctor. And if you disagree with somebody and in your gut you feel this just isn't right, she's never had this before, this is not how she behaves, the grandparents are bringing it up to me, then you need to pick a different source. And when you have someone that you trust, and then hang in there with them, it's a long haul.
Do you think that pediatricians have enough training about Lyme disease and tick-borne illnesses?
Absolutely not. We're told that the guidelines say that doctors should that you need to have an observed rash to count as a Lyme-related rash. And here are 3 cases in the CMAJ, all of whom doctors misdiagnosed. So we've got a long way to go. Also, doctors are still relying on lab tests done under 2 to 3 weeks of age. Early on, the ELISA test is often negative, so if you've had a negative test, and in general, a negative test does not mean you don't have Lyme disease. A positive test supports a clinical diagnosis.
Well, I know we have lots of different topics we could continue digging deeper into, and we might do that in a future podcast. But for now, I just want to thank you for your time, and thank you for joining us on this podcast, Dad, and thanks for being with me through the journey and learning with me.
Yeah, and thank you for being born.
Thank you for having me.
Okay. Bye-bye, Sarah.
Bye-bye. Mwah. So parents, let's remember that when we bring our children in from playing in the outdoors, don't forget to do a quick tick check. I want to thank my dad so much for joining us on the podcast. That was Dr. Ted Cormode. Lyme disease has been one of the biggest challenges our families had to go through, and if speaking about it will help another family deal with this disease, then I will be truly grateful. Thank you so much for listening. Stay safe in the outdoors.